We spent a lot of time this morning talking about patient-centered outcomes and patients. And it's important that we have the voice of the patient at the symposium. So I'd like to introduce Rita Roy, who represents the CEO of the National Spine Health Foundation, to give us a perspective from patients.
Thank you. I'm so deeply honored to be part of this panel, and thank you for inviting me to be here. And I also want to shout out to the NASS leadership, Eric Milbauer, who's in the room, who's been a supporter and partner of the National Spine Health Foundation for many years. If we think about a couple of data points that were presented today, Dr. Washba showed the grid of the National Institutes of Health and stated that NASS is a small organization within the NIH, which is true. The National Spine Health Foundation is a proud participant in the NIH coalition. And the ironic thing about that is that, as we all know in this room, spine conditions affect more people than any of those diseases that were shown that have large, hugely funded institutes. Spine conditions affect estimated 100 million Americans. That's roughly 1/3 of our population. And yet the funding and awareness for spine conditions is small. All those other institutes, many other disease states have very active patient advocacy organizations, and now so does spine. And I'm really honored that a number of individuals who are on this stage with me, Dr. Hu, Dr. Shafri, Dr. Wang, I'm missing somebody who participated in our programming, they participate on our medical and scientific board. And I think what's important about that is that the National Spine Health Foundation, as the voice of patients, is also informed by thought leaders in spine. Dr. Gobwal is on our medical and scientific board, has participated in programming. So having the information that we produce is informed by you, by NASS membership, by the physician community. And that's important because we think it is our job to responsibly message to the public the good news, the truth about modern spinal health care. I come to this position through my own patient experience, looking for information on the internet. And I can tell you that in 2017, when I needed a fusion for my spondy, there was a lot of bad news out there. And so one of the things that we are doing is we are taking the opportunity to tell honest, unbiased, vetted information. Dr. Gobwal, you showed a slide about a patient who sought multiple opinions and got 4 different approaches, right? That's the challenge. The beauty of spine is there's no cookie cutter approach to how treatment options happen. The challenge for patients is, what do I do? And coupled with the fact that we live in a shared decision-making world where the surgeons or providers will say to the patient, well, what do you want? One twin brother said, I want to get back to work in 2 weeks. Another twin brother would say, well, I'm here for the long term, right? So how does a patient make that decision? So informed decision-making is sort of the name of our game. I could talk for the entire hour, but I will just close by saying that responsibly messaging news to the public is something we take very seriously. And that's a job that involves all of us. And that is why we've created a coalition with the professional spine societies participating with us. It's the Coalition for Spine Health. NASS is a leading member in our coalition so that we get the voice of our professional societies. We have the voice of providers on our board, and not to be underrepresented is the voice of industry that helps not just fund initiatives, but provides thought partnership and how we develop our workflows. We have a workflow in bone health right now. If you go to the internet to Google and you put in the words osteoporosis, spine, the #1 search return will come back with the National Spine Health Foundation's authoritative digital content on osteoporosis in the spine. And that has been created through our Spine and Bone Health Task Force, composed of co-chairs Dr. Paul Anderson, Dr. John Dymar, and participants Dr. Venu Namani, Brandon Carlson, Ben Elder, Ganesh Shankar, and Zishan Sardar. So we are doing this work with the participation of the experts, and we are putting it out to the public. And just one word about accessibility to care. We would love to be engaged in a conversation conversations with payers to provide better access to care. We are not a lobbying organization, but we show up for those conversations. And our Spine Talks program, Get Back to It podcast, all of these resources with the voice of experts is available to anybody for free, on demand, at our website, spinehealth.org. And for us, that's an equity play, because anybody with access to the internet or a smartphone can go and hear the voice of experts. And that's one way that we are attempting to level the playing field for patients out there.
Dramatically. So I'd like to ask Rita, how does the Natural Spine Health Foundation work to understand some of the things that patients have on their mind that might not be so obvious to us as spine surgeons and spine professionals?
Yeah, thank you. So that's such a great question, because that voice of the patient is so important in cultivating. One of the things that we've created in the foundation is this spinal champion community, or community of patients. And we run a number of support groups. But I think one major way that we're able to cultivate the voice of patients is our really effective ability to conduct nationwide surveys. And in fact, CSRS is a participant in our coalition, the NICE partnership with the CSRS. And back when Jim Herrick was president, we were chatting about, what do patients want to know about neck conditions? What do they want to know? And so we put a survey up, and we are getting about 1.5 million visitors to our website every month. And the survey that we had up on our website was a pop-up. For 2 weeks, we had 5,400 people who had to enter an email and verify an email, answer that survey. And as an outgrowth of that survey, we developed, along with CSRS, a public education campaign around technic. And that was just a really exciting activity to do. And so today on our website, we are actually conducting a patient survey on bone health. So as I mentioned, we have a large workflow in place on osteoporosis in the spine, and closing treatment gaps there for surgeons, and also understanding the knowledge gaps for patients. And we've had that survey up for about 3 days. We have over 1,200 respondents on that survey, and it'll run for another 10 days. It got IRB exception. We plan to write this up as a study. So, the surveys are very important and powerful tools. We also, as I said, run these support groups. There's a Facebook support group. I have a nurse educator who monitors that group on a daily and weekly basis. There are about 3,000 patients in that group, and we cultivate and gather the feedback and responses and so forth from that particular group. I think those are two important ways that we do that.